Hello, my name is Stephen Myers, and I'm responding to the post by Stacia Lindsay on urinothorax. While I have cared for patients with pleural effusions before, the root cause for their pleural effusion had never been determined to be this particular medical condition called a urinothorax. In fact, before watching Stacia's video, I had never heard of such a condition happening before, so I was rather surprised by that. Um, the care provided to my patients with more standard pleural effusions was likely very similar to the care this patient initially received. Respiratory supports like supplementary oxygen and rest would be applied in response to reported shortness of air. But however, unlike Stacia's patient, none of the patients I had worked with had a pleural effusion severe enough to warrant placement of a chest tube. And of course, once it was determined that the urine was actually causing the pleural effusion for her, for this patient, um, that getting that urine flow going again was a big part of the treatment. Whereas with my patients, it was more having something to do with heart or lung issues more directly. Um, and it was quite surprising to me that urine flow obstruction could actually lead to a pleural effusion. As I mentioned earlier, I had never heard of this complication before. Um, and as far as how this affects my nursing practice, learning about the possibility and incidence of urinothorax reinforces to me that a holistic view of the patient and comprehensive assessment is vital to patient care. After all, the human body is really a collection of highly interrelated and interdependent organ systems. Disruption severe enough in almost any one of these organ systems will typically have significant negative effects in other systems as well. So it's just gotta keep an eye on the big picture. Assess every system. Make sure nothing's getting too far out of whack, in a manner of speaking. In general, I have not had the opportunity of caring for a patient with a chest tube. So if I were to care for this patient during that phase of his care, I would require further review of the critical principles regarding the care and maintenance of chest tubes before proceeding with his care. Other than that, um, as I said, in the case of this patient, I was just very surprised at this. I was also very surprised that this medical complication befell the patient for as simple a reason as a little clamp being left in the wrong position for an extended period of time. So it sounds like maybe someone kind of dropped the ball, or maybe somehow they got mispositioned, somewhere, how in patient movement. Not sure, but I mean, either way, this was a significant complication for the patient. It just goes to show how vital it is to pay attention to details when it comes to medical devices and healthcare in general. So, very interesting case. Thank you.